Hello and welcome to this podcast brought to you by the Isle of Man Anti-Cancer Association. My name's Sandy and I'm the Executive Officer of the Association and a cancer survivor.
And my name is Malcolm, a former surgeon and presently Chairman of the Isle of Man Anti-Cancer Association. In this podcast we want to talk about male cancer awareness. We know that, overall, men have a higher incidence of most types of cancer than women, due to factors other than simple lifestyle choices. This may be due to men usually being taller and therefore having more cells within their bodies, with a greater risk of things going wrong as a result of the increased number of cell divisions. However, we want to focus on cancer awareness in the organs related to the male reproductive system, and as such, only seen in those born as a male child: prostate, testicular and penile cancer. Men who've undergone gender change usually still retain their prostate gland, and such individuals, although outwardly appearing to be a female, are still at risk of developing cancer within this retained organ.
So let's start with the prostate. A small gland at the base of the bladder responsible for producing most of the seminal fluid to nourish the sperm. This is the commonest invasive tumour in men, accounting for around a quarter of all cancers registered on the island. It affects men usually over the age of 50, with the incidence rising with increasing age. The majority of men over 80 will have some cancer cells in their prostate that won't harm them, with only 1 in 25 subsequently dying of the disease.
So what are the symptoms that may be associated with prostate cancer? The common symptoms of prostate cancer are a weak or slow urine flow, passing urine more frequently or urgently than usual, particularly noticeable through the night, difficulty in starting to pee, pain or a burning sensation during urination, and unexplained urinary infections. In most men, these symptoms develop over many months and occur as a result of age-related non-cancerous enlargement of the gland, but you should see a doctor and get things checked out. Occasional other symptoms may include impotence or erectile dysfunction, again a not uncommon problem in men over 55 for other reasons, constipation, blood in the urine or semen, pain in the back with no other obvious cause.
There is presently no formal screening programme for prostate cancer because of the absence of a reliable, sufficiently sensitive marker for the disease or a safe confirmatory diagnostic procedure that is cost effective. However, there is a blood test, the PSA test, that can be done through discussions with your GP should you have concerns.
Testicular cancer occurs when cancer arises in one of the two testicles contained within the scrotum. Although rare in comparison to other cancer types, testicular cancer is still the most common cancer in men aged between 15 and 45, an age group in whom individuals often think that they are invincible and have a rather laissez-faire attitude to many things, including any potential health issues. On the island there are probably around 2 young men diagnosed each year with this type of cancer.
So, what are the signs and symptoms of testicular cancer? What should men look for? The most common symptom of a testicular cancer is a lump or swelling in part of one of the testicles. The lump can be as small as a pea and will usually be in one testicle only. The majority of cancerous lumps in the testicles are painless. Another symptom is the scrotum or ball sac, which may feel heavy, or you may get a dragging sensation or a dull ache within the scrotum.
Unlike with the prostate, which is hidden deep within the pelvis, it is fairly easy for men to check out their equipment, either themselves or by their partner. It is best done after a warm bath or shower when the skin overlying the testicles is more supple. It doesn't take long to do, just a couple of minutes once or twice a month. Roll each testicle gently between your forefinger and thumb. There is no need to squeeze. Feel for any lumps or bumps. Assess their size and texture or firmness. There are many simple causes for lumps in the scrotum, and finding a lump doesn't mean you definitely have cancer. But get it checked out. Don't be embarrassed about talking to your doctor about this part of your body. Don't just ignore it. Your doctor can quickly arrange a simple ultrasound test that will rapidly determine what is going on.
Now, there are a number of risk factors associated with development of testicular cancer, as well as things that you can do to minimise your chances of developing the disease. A family history with your father or a brother having had testicular cancer increases your risk. Height may also be a factor, tall men having a greater risk than shorter men. The commonest risk factor, though, is having an undescended testicle, one that remained within the abdomen where the testicles are formed, and which was not brought down by surgery as a young child. Sitting for long periods can also increase your risk. Testicles are contained in the scrotal sac hanging below the body because they function better at below body temperature. If they get too warm, it can reduce your fertility as well as increase your risk of cancer. So lads lazing around all day, such as when playing on your games console or computers for long periods of time, would do them no favours.
Penile cancer is a rare type of cancer that occurs on the skin of the penis or within the penis. It tends to occur over a similar age range to prostate cancer, from 50 onwards. Symptoms include a growth or sore on the penis that won't heal within 4 weeks, bleeding from the penis or from under the foreskin, a foul-smelling discharge, thickening of the skin of the penis or foreskin that makes it difficult to draw back the foreskin, a change in the colour of the skin of the penis or foreskin, a rash on the penis, or a lump in the groin.
There are a number of factors that increase the risk of developing penile cancer. HPV infection by certain subtypes of the virus through skin-to-skin contact, being uncircumcised from the teen years onwards, having an impaired immune system, and certain treatment for the skin condition psoriasis can also be associated with an increased risk.
If you have any concerns with symptoms that could suggest you may have prostate, testicular or penile cancer, go and see your doctor. Don't bury your head in the sand and ignore it. Most of the time it will turn out to be something simple and respond to simple treatments. But if it is a tumour, then the earlier that you seek treatment, the better the chances of successful treatment and the quicker that you will be back to enjoying your normal life.
For more information on male cancers, you can visit Orchid at orchid-cancer.org.uk, or you can phone the helpline on 0203 465 5766. They also have specific information about testicular cancer at yourprivates.org.uk. Prostate Cancer UK, also information there at prostatecancer.org.uk, and of course the MCIC telephone number up at the Nobles Hospital is 650735, and you can visit their Macmillan website at macmillan.org.uk. Thank you very much for listening to this podcast.